Hi, my name is Lydia Pobrich, and I am one of the owners of Progress MD. I've been lasering for almost 9 years on September 1st, so I know a lot about lasers. So there's simply just two different wavelengths. So when we think about light, we have to think about this like giant spectrum. So we have lights that are like infrared and lights that are visible like color-wise. Like some of the ones that we use for tattoo removal are actually like blue and green and red when they pulse. YAGs are not a specific color, but they are closer out in the spectrum. And then a CO2 is way far out in the spectrum. And so they're very far from each other, but both of them typically are targeting tissue and water and things in tissue. They're simply just two different things on the same spectrum. So the YAG that we're using is typically going to do more work kind of like more superficially and more at the higher part of the epidermis. We're going to be working on texture, we're going to be working on pigmentation, we're going to be working on tightening the actual like surface part of the skin. I think a lot of people think tightening and they think, this isn't like a full-on facelift, but it's going to be working on the texture and again, the laxity of your actual skin. So, and again, CO2 is a wavelength. The way that we're using it in a Fraxel version of itself, we're going to be targeting things like scars, stretch marks, fine lines and wrinkles, pores, skin laxity. It does help some with pigmentation for sure, because again, we are encouraging the skin to have turnover and to repair itself, and to do things like that. So you are going to have some some benefits there too. But again, when we're really thinking about Fraxel, we're thinking about texture, rebuilding and repairing the tissue.
So is it fair to say that YAG is a little less deep and CO2 goes deeper into the skin?
Absolutely. And even when you're thinking about, sometimes people will come in and say, hey, I had a Fraxel done. They confuse Fraxel with the wavelength. Again, you can Fraxel any wavelength that you want to. You're taking a beam that's already set and you're basically putting it through like a colander or like a screen door. So a Fraxel is simply a version of a wavelength. It's not a specific wavelength itself. So you could have an Erbium Fraxel, you could have a CO2 Fraxel, you could have a 532 Fraxel. They would all be totally different. Absolutely, and the irony is when we actually combine both of them together, typically we have a lower downtime. So when you're doing the Fraxel standalone with a CO2 Fraxel, here in the clinic you're looking at like anywhere from a 4 to a 7 day downtime on the face, as far as things like fully resolving themselves. However, if we add the Erbium YAG on top of the CO2 Fraxel, we can cut our healing time down to like 3 to 4 days on average. And it simply is because the Erbium YAG will eat the necrosis off, the tiny little holes that are produced with the CO2 Fraxel treatment itself. So it just cuts that healing time down. So again, people have their own relationship with pain, and definitely in laser land it's no different, just like when people get tattoos and things like that. However, we do numb everyone that gets either of the treatments and the combination of them as well. And I would say most patients say that it feels like a 3 to a 5 out of a 10 during the entire duration of the treatment. And I would say that's the case for at least 95% of the people that I've treated for almost 6 years with that piece of equipment. So I feel like it's not too crazy. A lot of people do it and it looks worse, and it looks worse during the healing phase than it feels. So I always tell people you're gonna look like a crispy burnt tomato, but it is totally worth it, because you're just gonna look worse than you feel for a few days, and then the results definitely speak for themselves. So we have a sheet that we've been using for almost 6 years for the specific treatment, and we've pretty much refined what someone's entire healing journey is going to look like from right after their treatment to 30 days post, as far as everything that you need to know, from like mixing a vinegar and water solution that you can spray on your face to help your face cool down, to all of the products that you can use when you can reintroduce retinols, acids, things like that, what the peeling time frame is going to be like, inflammation and swelling. We also send people home with a post-care kit That includes disposable pillowcase covers, because you are going to be wearing Aquaphor or Vaseline. It's not fun to get on your sheets. We do want to fix our face but not mess up our bedroom, and so we do send people home with the things that they need, ice packs, stuff like that. And so it's pretty easy. Again, it just isn't a cute process, but almost all of our patients feel like they can tell a difference in that area immediately within that first 1 to 2 weeks. And then studies have shown that you can see the benefits from either one of these treatments, especially the CO2 Fraxel, for up to 6 months post after that treatment.